Rebecca.
Hi.
Hi. I'm so thankful today. Rebecca has been willing. She wants to share a little bit about what she wants to do. What do you want to do here today?
I'm here today to get my lips filled.
To get the lips filled. Okay, so far we've already got her nice and numb. Something different than what we can be doing, at a dermatologist.
Yeah.
It's really wonderful. You've had your lips done or filled before, right?
Many years ago, yeah.
Okay, and did they get you numb or?
When I went to the plastic surgeons, no.
No.
And I didn't get the results I wanted.
Okay, so it's kind of in and out.
Yes.
And you felt everything, right?
Yes.
Okay, so now she is totally numb. I'm very thankful. I want you to zoom in a little bit closer here. Thank you. And we're just going to take a look at her lips. So really what we want to do here is they're smaller, right?
Mm-hmm.
Okay, and she wants to get some more volume. Okay, so what we're going to be using here is a product that we really love, and it's called Juvederm. So this is Juvederm. All it is collagen, and that's what is the volume of people's lips. So I'm going to show you the procedure. Okay, it's really simple, really easy, and we should see a pretty dramatic result right away. So we're going to do that. All right. So. Hey, Rebecca, just let me know. Just raise your hand if you feel anything at all, okay?
Yep.
All right. So I'm going to just have her tilt her head back a little bit. You want to zoom in a little bit here? All I'm going to do is I'm going to just put a little bit of this volume right in here. And that's nice. And instantly, we're going to see a nice result. So this is really sculpting the lips. I mean, it doesn't really make sense to not get the person numb. I question if you're actually able to deposit any of the filler where you want it, because the person's moving about or they're feeling everything. This way we can really do a nice job and really sculpt the lips. It's an art. So I'm going to share some of my techniques too with everyone, and I'm hopeful if you're another clinician and you're how are you doing there, Rebecca?
I'm good.
If you're another clinician and you like to know more about my techniques, I've been trained with the American Academy of Facial Aesthetics, and I would love to share with you what I do and have been trained with them. We don't want any duck lips here, right? No. So we don't do duck lips here at 412 Dental. So, and Mandy, she could tell you a little bit more about cost and what to expect or anything. You just give her in the comment section that you want her to PM private message you, and she will love to do that for you, okay? All right, so we're already working on the top lip. I'm just gonna give a little bit more. And we really want to be defining this Cupid's bow. We want to keep the shape. She's got a great shape to her lips, but she's lost volume. So really we know right where we're wanting to give this filler. And it's a sculpting, so I might have her come back in about 2 weeks, and there's a little bit of swelling that we'll see. In about 2 weeks, we'll have her come back and we'll check and see, do we want to do a little bit more? Can you turn to me a little bit? Okay. We want to see in 2 weeks, should we add a little bit more? Are we happy? I say love it, don't love it or hate it for 2 weeks. So we want to make sure that we get her back and check everything. And really the instructions I give people pretty simple. I don't want anyone to do a facial massage right after the treatment. Alcohol is a no-no. Wine or anything is going to cause potentially some bruising. Bruising could happen. It's possible. But we just want to minimize all that. How you doing there, Renee?
Good.
Good. You're doing a great job. Yeah, and I love doing this. I think it's just it's such an art. Lips are beautiful, and some of this volume loss happens just over time from sun damage. We talked about that. We can lose a little bit of this red to skin color tone because of the sun damage. So I'm really defining all that, but we encourage here at 412 Dental people to be using some lip balm. So you'll get to see what we use here at 412 Dental and just to protect those lips, okay? Because we don't want to be doing this very often. We just like to, and then that's another question sometimes people have is, how long, Elijah, is this going to last? That's a great question. About 6 months, up to 6 months. So, you know, we really want to be using the SPF lip balm, and yeah, and I just love, you know, taking our time here. So I really appreciate you guys getting to, you know, view this technique. I'm doing something called vectors, meaning, you know, the lips have shape. You don't just, like, you know, put a big sausage of filler into someone's lip. We don't want like 2 sausage links. There's a lot of anatomy and shape to the lip, so it's something, you know, we go in angles and almost like triangles. And there's also areas that should be more volume. When we look to the side, the lower lip, we'd like to get a little bit of a pout in this area, so I'm going to be putting intentionally a little bit more on the lower lip, just to get that pout. And will we achieve that? Absolutely. That's what we're looking to do. So I'm going to give her a little bit more there. I've already outlined the lips. And yeah, I'm just thankful here, you know, dentists can do this, and I think really this is our area of expertise. I mean, we're working primarily on the lips, in this area, the teeth. You know, the teeth are like the picture, the gums would be the matting, and your frame is the lips. So this whole picture has got to look good together, and, you know, dentists are looking at this all the time, so we should know good, you know, lip anatomy, and it is aesthetics. And yeah, it's just so wonderful. So I'm also going to give a little bit more. Just people like to see those Cupid bows, you know, those points. I keep saying the Cupid bow. We want to make those a little bit more defined in this area. And I teach people, you know, if we're going to do this, we want to make sure we're not crossing this area here. So I'll give just a little bit in this area here. And I gave her a little bit numbing in this area too, because sometimes people feel this a little bit more. Now I'm going to show one other technique. As we age, we're going to lose a little bit of this volume here, and the lip is going to start coming down, and it's going to tuck into the mouth, and it's going to make that upper lip look smaller. So what I'm going to do is I'm going to really redefine what we call these columns or philtrums with the remaining filler. So this is what I like to do. Can you turn toward me a little bit? Awesome. And we'll just be really careful. She might maybe feel just a little bit here. You okay?
Mm-hmm.
And this has actually some numbing in it as well. So, you know, if there's any little areas that someone might feel a possible little pinch, that should, you know, be eliminated right away. And she's doing such a great job. Awesome. And this is great. We don't do this every day for her, but you know, when we're doing it, we want to make it as comfortable as possible. Okay, so I'm going to just finish up with doing the technique that I like to use. Here's the 412 Dental lip balm. It has an SPF in it, no harsh ingredients or anything like that. By the way, you get this every time you get a cleaning. We want to give you this. So I'm going to just put this on her lips for protection, but also I want to make sure that there's nothing lumpy or anything like that here, so we want to smooth everything out. It is a dental, you know, it's a lip implant, right? So what we're going to be doing is just finishing up by shaping everything. So just some cotton applicators, one of my techniques here. Okay, so go ahead and open a little bit. Just feeling the lips here. Okay, making sure, checking that there's nothing. Okay. And yeah, we're just everting or rolling out the lips, making sure that none of that filler has gone in the mouth. We don't want that. You know, no one's going to see that anyways. Would someone feel that? Potentially, and that would be pretty annoying. So we're just making sure and ensuring, and I'm also shaping the lips, making sure that there's nothing lumpy. So that's looking lovely. And then last, we're going to go ahead and define those philtrums. So we're going to push here a little bit. Just putting that in. Putting that in there. Okay. And then last, just really defining that anatomy. Go ahead and open a little bit. Yeah, so she's numb right now, but you can come in and you can probably already see what a difference. Go ahead and open just a hair. These lips are looking lovely. All right.
Wow.
So hope to see you soon here at 412 Dental. Love to feel your lips, and also we do many other things.
Yes.
Rebecca has got the Botox already. She's looking great. Maybe eventually we'll do some cheek filler, you know, as time goes on. And of course, we're recommending what? Use what on your face?
I don't remember.
Sunscreen, right?
Yes.
Yeah, we want to be protecting the face, so we minimize the damage to the face.
Yes.
All right, take care. Please post in the comment section. Love to reply to your comments. Have a great day.